Good evening, everyone. My name is Sherry Soltani, and welcome to today's TV. To give you a recap of our last program, we talked about mental health illness, depression, and the importance of treatment and the awareness that we all should know. Today, we are going to continue about the same discussion, plus we'll discuss about the relation between mental illness, drug, and alcohol addiction. According to British Columbia Medical Association, today it is estimated that almost 400,000 British Columbians suffer from some form of addiction or substance of misuse. So we have invited again Pega Bepahani, is a registered clinical counselor with the BCACC. She also holds a master's degree in counseling psychology. And Elke Babiki, MED, she's a consultant of a corporation to a clinical and counselor to a private practice in Vancouver and Toronto. Now, we would like to focus on this matter and to learn about the difference between mental health illness, depression, and addiction. Also, we seek to explore the significance of family involvement in supporting individuals who are experiencing these challenges.
Happening now on News 1130, an advocate for people living on Vancouver's downtown east side is calling on the Prime Minister to declare a national health emergency when it comes to opioid overdoses.
Blythe sees the havoc the illicit drugs have caused in her community. She adds prescribing opioids to addicts using street drugs could make a difference on many levels.
That person costs less than having a person overdosing in the street over and over again. It's going to cost taxpayers less in the end if we deal with this properly and get over the stigma and take some leadership on this issue.
There were 914 overdose deaths in the province last year, most of those linked to powerful illicit opioids like fentanyl. I'm James Sabone.
Welcome back, ladies, and thank you for joining us again. For those who did not watch our program last week, can you just introduce yourself? We start with Pega.
Hello everyone, my name is Pega. I am a registered clinical counselor with BCACC, BC Association of Clinical Counselor. I'm so happy to be here tonight with you all.
Thank you once again for being here again. And Elke?
Hello, I'm Elke Babiki. I'm a registered clinical psychotherapist in private practice for over 30 years. I've worked with individuals and companies, and I have also led workshops in Europe and in Canada, and I've written 3 books, 1 in German and 2 in English.
Wow. Thank you, Elke. And can you please tell everyone what's the discussion, tonight's discussion?
Tonight we are talking about depression and mental health and substance abuse. And yes, there is a connection between mental health and substance abuse. People with mental disorders, anxiety and post-traumatic stress disorder are more likely to use substance abuse to self-medicate. That is true. Mm-hmm. And we'll talk more about it tonight.
Yeah, thank you. Now, let's just, go back and recap what we started last week, because this is just the start of an issue that we do have in BC, especially in Vancouver. Let's just recap everything about the mental health and mental health issue crisis that we do have in BC, and what is the relationship between the mental health, depression, and the addiction, Pega?
Okay. Basically, addiction is recognized as a basically avoidant strategy for people. We call it like experiential avoidant strategy. People, when they experience lots of overwhelming emotions and they don't have a good, healthy coping mechanism to face it, usually they kind of they kind of reach out to this kind of coping mechanism to get some sort of comfort and basically use it as a coping mechanism to just feel better. You just sometimes, I hear in my session the clients, they say that this event or this situation is so overwhelming and it's so painful that I just need something to make me feel better, to
Yeah.
just subside this pain, And usually, because it's basically very um, quickly they see the result and very available and accessible. Yeah, and so that's why it's easier for them to use this kind of strategy, like to use alcohol, and gradually they develop tolerance, and in the face of challenging life events, they have to use more and more alcohol, substance like drug or alcohol, to get the same result.
Either or that actually calmed him down with taking either
Yeah.
alcohol or drugs, and then they became addicted to it. So, what do
Yeah.
you what is your comment on that, LK?
Well, yes, that is addiction. Addiction is when is a certain result that you desire actually requires more and more of the same, um, either drug or alcohol. So actually, let's look at alcohol. People think alcohol makes them feel relaxed, which it does for a period of time. And what it does actually, it inhibits the inhibitors. So a person is feeling more uninhibited. And that feels great because they're saying, hey, now finally I'm feeling normal.
they
And,
they think they feel normal.
I'm not feeling depressed. Great. So, it's a perfect self medication thing because now they're feeling great. But actually, alcohol is a depressant. So, what happens after the effect wears off, the person in the middle of the night wakes up and they're actually more irritated and they're actually responding with needing more alcohol. And next time, they're going to need more alcohol to get the same response. And they're actually going to get more depressed because the more alcohol they take, each time it leads them more into depression and irritability. So, alcohol is actually a depressant. So, over time, it worsens the depression. So, and over time, not only does it worsen the depression, over time it can also create changes in the brain, in the brain. So your brain then becomes such that it actually creates more mental disorders. So it's a pyramid. It keeps going. The more you abuse alcohol, the more mental disorder actually starts happening.
Well, to me, is like when you're addicted to alcohol or any kind of drugs because of the mental health depression, it brings the cause of losing money, losing family members, losing friends. What do you have to say about that, Pega? Like, what's the lifestyle that you think a addicted person have, or what is the outcome to this?
Basically, addiction is has a huge influence in different aspects of a person's life. Like usually, people who are under influence of drug or alcohol, they can't be present with their environment, with people, with family members, and they sometimes it because it impact their threshold of tolerance. Sometimes they show some sort of aggression. They become short fuse, quick temper, and they react, like basically thin skin, and they react to their environment. They basically dump their anger, or and people, usually their family of addicts, they walk on the eggshell around them, you know and so that's why sometimes they indirectly they are enabling them, because they don't want to get those reactions, and they basically enable them by giving them money to provide, um, basically drug, to use it to get drug or alcohol, to just kind of keep them like in that basically functional, but in fact in long term it's going to have adverse effect on
Yeah,
the whole
yeah,
system, like, I mean,
I agree.
yeah.
Yes. Yeah, and what do you think about that, LK? Do you think that any life changes or lifestyle changes will, with the family?
Well, lifestyle is hugely important in depression and in alcohol because they found that treatment in depression has a lot to do with their activity. So, if a person actively does depression, that means that that person is going to be depressed. And what do I mean with actively doing depression? That means they're not getting out of bed, they are not feeding themselves properly, they are not exercising, they have no motivation to exercise, they're not going out to be with people. So, actively doing depression leads that kind of lifestyle. But it's a catch 22 because you're not feeling motivated, you're not feeling worthy to socialize. So what happens is, it's what comes first, the chicken or the egg. And then people do resort to alcohol to feel more normal, and then it actually becomes worse. And any kind of drug addiction, like alcohol sometimes leads to drug addictions of different sorts. And heroin, you don't even get the high after a while, you actually just need the heroin to feel no pain.
Yes, because
So
at that point, that person is in so much pain if they don't use it.
yeah,
And this is
that's right.
actually a big crisis that we do have in BC, especially in
We do.
Vancouver, and
Yes.
it is very hard to see people losing their
Hmm.
money or losing their family because of it,
Hmm.
and they become homeless.
Hmm.
So it is very important to address that, and I don't know
Hmm.
the sources that they can get help towards the
Hmm.
government. Is any of you have a comment on that? Can explain more?
um, yeah, I know that in BC there are some resources and strategies they are in place for people who are in basically in need. Um, so I can just go through those resources. One of them is Crisis Line, BC Crisis Line, that people can find the number and they reach out. The other is Mobile Crisis Response Teams, um, also assertive community treatment teams, community mental health centers, hospital emergency departments, also provide some support for individuals in need, and also provincial mental health and substance use hotline, and also mental health and substance use services in BC. They are all basically designed for supporting individuals in need.
Elke, can you give us some example of your own patients?
Oh, Yeah, let me think what might be a really educational piece. I think generally everybody who uses either alcohol or drugs is trying to escape, and they are either trying to escape pain or that they are trying to escape into a different reality. And that reality is much more exciting because everybody actually wants to experience excitement and be closer to that kind of spiritual experience of excitement. And that's why a lot of people do abuse drugs because they have this almost spiritual kind of experience. And it is very, very seductive. So people who have the capacity to be around, people who give them drugs, it's about temptation. If they are around temptation, they are more likely to take drugs again. So it is actually very important to have the family involved because the family can can keep people on the straight and narrow and help people to experience life and excitement in a much more productive way.
Um, how does kids actually get involved with this? Because you guys can jump, any of you guys can answer this question. But kids in school, especially, that they're offered drugs or alcohol, and they think if they don't take it from their friends, they're not cool enough, and they have to take it to be one of them. And what do you have to say about that? Like, how can we stop and
Well, I
go ahead?
I think with teenagers, their main thrust is about belonging. They want to belong. So if a child is very influenced by his peers because they want to belong, they will do whatever it takes to belong. And it's an easy way to belong. I think it's very important for parents to be involved and to recognize what's really going on. People who have parental involvement are much better at, refraining and actually getting better if they have fallen into drugs. It is really important for parents to intervene. I think reality, it's a reality check. People have to get realistic. Also, I think people have to realize what uh, actually using weed, like a lot of young kids think that's really, really benign. And the parents may think that's really benign. But the younger somebody uses, the more, danger for that individual because they
For
lack the
later on in
motivation
future.
for later on. Yeah. And it can lead to brain changes. And in some cases, if somebody uses very, very frequently, it can lead to actual psychosis.
Oh.
So we have, I've had a client where this actually happened. The severe use of weed actually triggered a psychosis.
Oh,
And
I had no
mhm,
idea even that now weed is actually something that is legal in Canada, and I had
okay,
no idea
yeah,
severe use can actually cause a mental illness.
mhm,
That's good to
yes,
know.
you
Yeah.
can. Mhm, mhm. Yeah, that's
So, what kind of
long-term
mental
use.
illness, like the psych? You said what kind of mental?
Psychosis is something that is not really depression. it actually involves hallucinations and delusions and
Mm-hmm.
illusions, and it's more severe, and it needs to be treated with medication, with the right kind of medication, and it needs to be diagnosed properly.
Mm-hmm. Now, Pega, do you have any comment? You don't jump in the conversation. Come on. Do you
Yeah,
have any
I
comment?
just maybe something that I want to add is
Mm-hmm.
that, as parents, we want to also be mindful what we are role modeling to our
Mm-hmm.
kids, because sometimes, people come and say that, I'm concerned about my child, he's under stress, like school and homeworks and like exams, and I see that he's using drug or weed or something like that. But when I ask them about how they cope with their life challenges, and they say that I smoke, and I use alcohol. So what you are
To
role
help the
modeling?
children, they smoke and they
No, no,
use alcohol.
no, not to children themselves. I
Themselves. That's
ask
what I'm
them,
saying. Themselves. Yeah.
how do you cope with your own personal life
Mm-hmm.
challenges or how do you basically relate to your emotion when you are under
Interesting.
grief or
Mm-hmm.
sadness? And they say that just a glass, like a couple of glass of wine every night, and they are concerned or they are complaining about their child why
So
they
they're
are.
hiding their situation instead of
Mhm.
solving the situation. They're kind
Right.
Yeah,
of.
they actually, children basically, they look at their parents, they
Mm-hmm.
see that when they get challenged, when, for example, they are grieving for loss of a person, how they treat themselves, how they treat their emotions,
Mm-hmm.
and when I'm drinking to numb my emotion, what I'm sending, what kind of signal message I'm sending to my
Mm-hmm.
child,
Mm-hmm.
that okay, you can use it, I'm actually indirectly giving a permission, that you can also in future when you face any challenges, these are maybe like appropriate, these are the way that you want to cope.
Mm-hmm.
So I mean, this is also important that for some teenagers is very they are very basically ready to use that,
What is the well, school board relation to this? Like, what does the school boards need to do to maybe educate the parents more, or have more educational sessions or courses for kids? What do you think about that? Any of you?
I think it's important basically for to um, provide education for both, for children and also for adults, because basically we are not 24 hours in their environment. They're basically they at home with them. That
Yeah,
family system, they
yeah.
have huge influence on how children they react to life and their stressors.
Hmm. Yes, I agree. Um, Now, the reason I talked about kids, because you know how it is when you're actually going like teenagers or young adults. I'm driving in the street, and I see these guys holding a card, or a placard, or showing, saying, I don't have any home, I need money. And as soon as you look at that person, that young adult, or even a teenager, you see that this person without no job, begging for money, but begging for money for what reason? Is it because he or she is a drug addict, or because they want to use it for, and just get the money and use it? Or what's the purpose on that?
That's
Elk.
very, very, very likely that the person needs it for drugs. And, that's one way of, surviving. Now, how do you deal? I mean, there are places in Vancouver like Covenant House that seems to do a really good job with teenagers and rehabilitating people.
Mm-hmm.
We do need places like that where people can be taken to. I think we have a lot, a growing number of people on the streets now, which is a concern because they're not treated. And whatever the treatment method may have to be, it could be addiction rehab. I think, if that's the case, that's the first thing they need to do is do addiction rehab and then deal with whatever trauma they may or may not have. But I think we don't have those kinds of facilities, and people are increasingly on the streets.
Yes, there are. Now, what I'm thinking is that when you actually have too many people in the street, to me, is that did they have a mental health depression first before they became addicted, or they became addicted and then have the mental health issue? You know what I mean? Do you guys have
Right.
any comment on that?
Well, I think, mental health issues can lead to addiction, and it definitely is difficult to catch because these days, a lot of times when people, young people have issues, they hide it quite cleverly behind jumping on some kind of bandwagon. For example, they hang with a drug crowd and don't address the issue. And if the parents collude and don't address it, it becomes it becomes a combination because the mental disorder becomes bigger by self-medicating through drugs. So it's a compounding issue. But most likely there was some kind of underlying mental disorder, some trauma or some depression or some experience that they couldn't process properly. So they started to medicate. But there's some people who are more addicted personalities than others. An addicted personality, it does seem to sometimes run in families, and it could be, genetic, or it could be just the way they cope, with dealing with trauma or dealing with depression or sadness, or they're not processing the trauma or the sadness. They are dealing with it by escaping. And and addiction tends to be a personality trait, to have an addictive personality. Some people don't actually easily become addicted, and some people become more easily addicted. And that is something people have to watch out for, especially if they easily fall into that category. They have to discipline themselves more not to do that.
Now, uh, can you ladies let me know what's the role of or involvement of the family can impact that a person's life? Is that I know that Pega touched a little bit about that subject, but what kind of involvement that the family can have to impact that life?
I think the first thing the family can do is actually do a crisis intervention. So if they recognize that there is an issue with alcohol or drug abuse, that they actually address it. And often it takes the family to hold the individual accountable. And if that happens, I think there is a much higher possibility that the person then does something about it.
If you don't mind, I have a comment to make here.
Yeah, go ahead.
And okay, it's about family involvement that has a crucial role. And something that I observed is basically the um, positive impact of family therapy. That basically it, because sometimes basically that symptomatic person is basically is reacting to the environment. So the family, they are dysfunctional, unhealthy, and the dynamic is not promoting individuals' basically growth. So family therapy can positively impact the dynamic and create some promote open communication between individuals and improve understanding and um, help all family members to basically heal and grow together. And so that was just, I thought that is important.
Um, Now, Elka, you touched base on last session, last program that we had. You talked about, um, you know, between women and men, having a mental disorder or a mental health, depression. And you mentioned that women has more because they're more emotional, and men is more, leaning to drugs and alcohol. Can you explain a little bit more about that, and and so we can understand why women and men have they reacted differently in this kind of situation?
Some of this is actually cultural because women are allowed to be expressing their emotions more, and men aren't supposed to be crying and that kind of thing. I know that's changing quite a bit, but it's still quite ingrained in men. And in general, I think men consider solving their problems with other people a bit of a stigma more than women. So women tend to want to solve their problems with somebody else. They share, so they are more women in psychotherapy than men. They tend to be the better clients for different reasons. One, a good client is somebody who wants to change. A good client is somebody who is looking for transformation, and they'll do anything to do that. So women tend to be looking for that more actively, and that's the best client. Men sometimes, get reluctantly brought into sessions, and sometimes men, are very, very keen participants. So, generalizing doesn't do men justice for sure. But looking at statistics, men tend to use more substances and medication and physical things to deal with their anxiety. So statistically, women have more depression and anxiety, manifesting that more, and men using more substances and medication
Interesting.
to, yeah, to deal with their depression or anxiety or issues.
Thank you. And now, Pega, in what ways can lifestyle factors such as exercise, diet, and sleep influences the course of the depression or addiction?
Yeah, lifestyle plays a crucial role actually. However, it's a complementary to other modalities that we need to apply when somebody is struggling with mental health disorder, and something like basically exercise, diet, sleep, they are all and social activities are very important. Like exercise activity, they have shown a very positive effect on mood and help alleviate the symptoms of depression. So basically, when you are active and you do exercise, it will release endorphin, which is basically natural mood lifting chemicals in your brain. So that impact your depressive mood, and also it reduce inflammation and improve your sleep, and boost your self-esteem and your self. Also, in terms of diet, also is playing a huge role. Basically, a nutritious and balanced diet includes fruits, vegetables, whole grain, lean fats or protein, and healthy diets. They also provide essential nutrients for your brain, and also some other basically nutritions like omega-3 fatty acid or vitamin D and B. They also account for improvement of your mood regulation. Also, in contrast, basically diets of high in processed food and in sugar and unhealthy fats and alcohol can has basically in adverse effect on your uh, mental health, and also impact your depressive symptoms positively.
Good to know. Thanks. It's interesting to know these factors as well. Now, how do you, LK, how do you approach the concept of treatment resistance and depression, and what strategy might you apply to address that?
Yeah, sometimes it seems impossible for a person to get the the treatment through medication or through psychotherapy. And if a person, for example, needs to be on suicide watch, and it gets to the point where there is a high risk for suicide, there might be electroconvulsive therapy that is being involved, because it seems to relieve the depression and the suicidal ideation. So there are electrical currents that are passed through the brain to relieve the depression. Another method that can be employed is transcranial magnetic stimulation. And that means that different treatment coils are placed on your skull to send brief magnetic pulses into areas of your brain that are involved in mood regulation and depression. And that seems to be helping some people. It's called TMS, or transcranial magnetic stimulation.
Very well. Now, it is very complex. And yeah, so definitely a person needs to go to a counselor or get counseling or help from the government. Is there
Yes.
anything you ladies have not mentioned in this session?
Good self care, um, appreciation, gratitude seems to be going a long way to counteract some of the negative filter that people with depressive attitude have. So that's always generally, an important thing to remember all the things that people are grateful for.
And you, Pega, do you have anything to add?
I just want to really mention that never actually judge people who are struggling with mental health. It can happen to everyone, and sometimes, really the life event is so big, to basically be able to to face it. And so it's really develop that attitude of compassion and try to understand and really support your friends or people who are struggling,
People
without,
around you. Yeah.
yeah, really use non-judgmental lens, to
I
look
agree.
at them.
Yes. Yeah. Well, once again, thank you, ladies, for coming to our show. And it was very and truly educational. And I know we touch some, basic, because I know this is a broad and discussion. And I do appreciate your time. And thanks again for joining us in this program. If you have any questions or comments, please email us at skyrisemediasociety@gmail.com. Thank you for watching and see you next time.